Right place of care is a term often used in hospitals and healthcare. But what does it mean? Essentially, it is patients being cared for in the most appropriate location by medically competent teams at the lowest possible cost. In these next videos, we are going to review the different locations people can receive care that best suits their needs. This first video will review non-urgent care hospital settings and non-hospital transitional settings that include transitional care units and alternate level of care units in hospital and outside the hospital, rehab units in acute care hospitals and separate rehab hospitals. A person who is recovering in an acute care hospital from an injury or an illness may reach a point where they no longer require acute care, but instead need rehabilitation. Rehab can help people to regain strength and function. People who need rehab may be transferred to a rehabilitation hospital or may receive outpatient care in a community or hospital clinic. Some acute care hospitals have rehab units, however, typically these are separate rehab-specific hospitals. The acute care hospital will determine if a person is eligible and would benefit from an inpatient rehabilitative program. As a caregiver, you can ask the doctor or other hospital staff about this possibility. It is important to note that some physical rehabilitation programs will not accept care recipients with cognitive impairments that impedes their therapy. For example, if the care recipient is unable to retain therapeutic instructions or understand direction, it is unlikely they will be considered a candidate for inpatient rehab. In hospital, when someone has recovered to the point they are considered medically stable and no longer require hospital-level care, but cannot be discharged, they may be designated as alternate level of care, or ALC. This means they would be best cared for in a less intensive setting. The reasons people cannot be discharged are usually that they don't have the supports required to return home, or they need more care than can be provided at home and don't yet have a place to go. As the name suggests, these beds are not a permanent residence and are for people who are waiting for their right place of care to become available. A person may not be able to return home for a variety of reasons, including waiting for equipment to arrive, for a home to be adapted for accessibility, for in-home care to be available, or for recovery from an injury or illness. As a caregiver, you may also have health issues that in the moment prevent you from providing the care you have been typically giving. It is also common that people designated ALC may not be able to return home at all and are waiting for a spot in a setting where they can receive ongoing care, such as a retirement home, assisted living, or long-term care. If a person is designated as ALC or at risk of becoming ALC, they may be eligible for a stay in special units that provide inpatient care outside of hospitals. These include Reactivation care centers, transitional care units, reintegration care units. These types of units or beds are not permanent and are for people who will either return home or be moving to a setting such as a retirement home, assisted living, or long-term care. There are similarities between these units. All offer varieties of inpatient, non-acute care and are designed for people who are medically stable and who need support to regain or maintain functioning until they can transition to a setting for more care or a longer-term living situation. Some hospitals have reactivation care centers that they operate outside their main hospital. Patients in these units receive care from hospital staff. These are units for people who no longer need the intensity of acute hospital care, but need support to continue to heal and recuperate. The focus in these settings is on restorative care. Reactivation care centers can provide a place for further recovery and may offer therapies, rehabilitation, and activation supports. Other hospitals may offer similar options called transitional care units. Michael Garron Hospital, for example, operates the off-site Q Beach unit, a comprehensive transitional care unit for hospital patients who are ALC. Transitional care units typically offer around-the-clock nursing, personal care, and other rehabilitation supports to support healing and maintain or regain functions. There are also reintegration care units in Toronto that provide ALC patients, or those at risk of becoming ALC, with a short-term supportive place to go post a hospital discharge. These units focus on reactivation and engagement and allow people time to plan and/or prepare for a transition to home or a supportive environment, such as supportive housing or long-term care. ALC beds can be hard to come by, and often the patient's healthcare team needs to advocate for a spot on their behalf. A bed may suddenly become available, but be quite a distance from the hospital or the caregiver's residence. As of September 2022, Bill 7, known as the More Beds, Better Care Act, allows hospitals to transfer patients to nursing homes not of their choosing, given they are cleared for discharge and consent to the move out of hospital. As a caregiver, you may experience pressure to provide more care than you are able to realistically give. You may need to advocate for the care setting that you feel best supports you and your care recipient. If you think your care recipient would benefit from one of these types of settings, speak to the hospital staff about the options that may be available. No matter which is best suited for your care recipient's next move, there is much to consider, and having you as their caregiver and advocate is an invaluable asset to them getting to their right place of care. To help navigate these and similar caregiver resources, visit the East Toronto Health Partners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.